I'm Dana Perdigon with Hardcore Medical Training, and I'm here today as a registered nurse and medical person to tell you about Narcan and opioid overdoses and what to do if you experience or witness an emergency. Narcan is going to be outside the hospital. It's over the counter, so another name you could call it is naloxone. First responders are trained, and the most important thing to know is if you witness or think there's an overdose on opioids, you might think to yourself, are there drugs around? Why is this person not breathing normal? Your first response, if no one else is responding to it, is call 911, get me an AED. Does anyone have Narcan? Does anyone here have naloxone, Narcan spray? It's one tiny spray only once. We don't want to use it and test it. So you would, if you have gloves, use caution. Have 911 hopefully on the phone already nearby, but the moment you have Narcan, you'd use it. If you weren't sure if it was opioids, it's better to give it to somebody you suspect has substance issues with drugs or substance of any kind, and you're not sure if it's an opioid or not. You can still use it on someone who's suspected of opioids. Spray. Be clear that if they're laying on the ground, flat, at that point, you turn them over if they begin to vomit. You know, as long as you have the ability, these are a 2-pack of Narcan if you do get a box of it. So if you need the second dose, don't be hesitant to give the second dose, because if EMS hasn't arrived yet and they're getting worse and not better, I would give the second dose. No telling what they did exactly at the time, but it works quick. It's a usual within a minute response. It could be 2 minutes. You're standing by, you used Narcan maybe, you had it, you ran out, you maybe used 2, but EMS isn't there yet. If you're safely able to check responsiveness and there's no pulse, hands-only CPR is recommended immediately, because now they're dead. There's no pulse, there's no breathing, they're in cardiac arrest. The question could be, if they're already unresponsive and you witness it and you're doing CPR, you could be thinking, if there's an opioid, get Narcan, 911's on the way, get the AED, and as soon as Narcan does arrive while someone's doing compressions, someone can administer it. Spray, there's one tiny spray, be clear to back away. You could have a second dose if you want to, if EMS hasn't arrived. While we're doing compressions, someone else could give a second dose after about a minute or 2. They could wake up and be really cranky and really combative, so you have to be cautious not to get injured and in the way of their confusion. So you can't restrain them outside the hospital, but in the hospital there's protocols and procedures to help with that for your safety.
Thank you for watching! If you enjoyed this video, please like and subscribe. Follow Healthy West Orange for more.